This presentation is about diet and its relation to diseases. This submission is by Sonal Bisht and Chauhan. The topics in this presentation are gastric ulcers and how the diet affects it, celiac disease and how diet assists in people with celiac disease, gallstone disease and diet assistance for gallstone disease, the conclusion and references. What are gastric ulcers? Gastric ulcers are sores that develop on the inside lining of your stomach and the upper portion of your small intestine. The most common symptom of a gastric ulcer is stomach pain. Consuming foods such as the following may greatly affect you having this disease. Foods like coffee, chocolate, spicy foods, alcohols, acidic foods such as citrus and tomatoes, caffeine, foods like buttermilk and yogurt, which are probiotics and which is very good to consume, soybeans, licorice, grapes, broccoli, kale, etc. They can help treat and prevent this disease. Food intake plays a huge role in carrying these diseases. What is celiac disease? Gluten, a protein present in wheat, barley, and rye, causes celiac disease. It is also known as celiac sprue or gluten sensitive enteropathy, which is an immunological response to consuming it. If you have celiac disease, ingesting gluten causes your small intestine to react. This response wears down the lining of your small intestine over time and prevents some nutrients from being absorbed. Intestinal injury frequently results in diarrhea, exhaustion, weight loss, bloating, and anemia and can have catastrophic consequences. Symptoms experienced in adults, such as diarrhea, fatigue, weight loss, etc., and malabsorption in children, can impede growth and development. Although there is no known treatment for celiac disease, most people find that adhering to a strict gluten free diet can help control their symptoms and encourage intestinal recovery. How following a diet may assist a person affected with celiac. To prevent any effects of celiac disease, a person must first read labels on everything they consume. Wheat, rye, barley, bread, pasta, cereals, and oats are all potential sources of gluten in the diet. Beer, pastries, cookies, and cakes. A lot of manufactured foods could potentially include gluten. Anyone who wishes to stay away from gluten needs to carefully read the labels. Foods such as meat, fish, seafood, eggs, dairy products, fruits, vegetables, legumes, nuts, tubers, and fats like oils and butters should all be considered while following a celiac diet, that is, a gluten free diet. Now let's talk about the gallstone disease, the gallbladder. It's a little organ under your liver where the gallstone solid objects originate. If you have them, your doctor might diagnose you with cholelithiasis. To help with digestion, your liver produces bile which is stored in and released by your gallbladder. Waste like cholesterol and bilirubin, which your body produces when it breaks down red blood cells, are also carried by bile. Gallstones can develop from these things. Pain in your upper body, upper belly, frequently on the right, just behind your ribs, may be one of the symptoms. Your right shoulder or back hurts. A bloated stomach, vomiting, additional digestive issues such as indigestion, heartburn, etc. These can all be symptoms. So, gallstones are more likely to form in persons who eat red processed meats, eggs as a part of an unhealthy diet. According to researchers' trusted source, unhealthy fats can be found in a variety of foods, including fried foods, numerous fast foods, red fatty meats, processed meats, full fat dairy products, baked products, sweets, chocolates, candies, ice cream, etc. Diet assistance for gallstone disease. In 2014, researchers examined the high impact of high fiber diet on biliary sludge generation during an intensive weight loss program for obese individuals. The chance of developing gallbladder disease is increased by biliary or gallbladder sludge. People who fast or lose weight quickly may develop it. A high fiber diet helped people create less gallbladder sludge, which decreased their risk of gallbladder disease. This implies that fiber may help prevent gallbladder disease generally as well as in patients who need to reduce weight quickly. Fruits, vegetables, legumes, and other foods are good sources of fiber, which should be eaten during this period. Conclusion. We chose different diseases that may or may not have a relationship to one another, but the one thing that can hugely impact the effect of a disease is a person's diet. A diet may sometimes be the last thing to look at when a patient displays symptoms. We would like to focus on the fact that having an unhealthy diet may hugely impact the condition of a patient. The diet plays an important role even in the road of recovery. Therefore, it should be followed on a regular basis to avoid catching or in some cases get some extra help in treating the same diseases. Diet has been the most common underlying cause of various diseases. This presentation is how we intend on showing how different diseases that may vary physiologically in nature can have the very same root cause, their diet. Thank you.